Once again, we're ready to follow Howard Dean anywhere. So Howard started as a country doctor who got pulled into politics to improve his state and his country. There are plenty of full-time doctors and nurses who agree with him that the healthcare system isn't working, not working for patients, and it's not working for the healthcare workers either. Dr. Salomeh Keyhani is a practicing primary care internist and health services researcher. Let's hear it for internists. Yeah. She completed residency training in internal medicine at Johns Hopkins, and now she's an assistant professor at health policy at the Mount Sinai School of Medicine. Her research interests include drug policy, overuse and underuse of medical procedures, and how organization of healthcare services affects the quality and costs of care. Because of her experiences as a doctor and her serious research into the health system, Dr. Keyhani is working actively for healthcare reform. She is active in an HCAN affiliate, the National Physicians Alliance, and she serves as the president of the board of their foundation. Please welcome Dr. Salomeh Keyhani.
Thank you for that introduction, and it's great to be here today. There we go. The title of my talk is The Public Plan, Perceptions and Reality, and I titled that because I constantly hear the public plan is being attacked again as rationing care, poor access, and waiting in lines. And I thought I'd just start talking about a few of my own experiences working in the private system and in the public system to sort of tease out really who's rationing care. So my first case is Linda. This is a pretty mundane case. It's not sensational, but it gives you an idea of what's happening every day in practice. She came to me because she had a cough, a little bit of weight loss, and I got a chest x-ray, and I got concerned, and we needed to get a chest CT to do some more follow-up. And I called her HMO, and after a few minutes, I managed to get on the line with the nurse. I explained the clinical scenario, and she agreed with me. Yes, this person required a CT scan. I thought that was very easy, and I was very happy, but then she said that I would have to fax a form to her. I said, okay. She said she was going to fax a form to me, I was going to fill it out, and I had to fax it back within 24 hours. If I didn't, we'd have to start all over again. Okay, so I said, that's fine, please fax me the form. I waited, the form wasn't faxed. The next day, I went and looked again in my mailbox, there was no form. So I called them again, spent another 30 minutes on the phone, and this time I asked them, can you fax it right now? I'm standing right here by the fax machine. So I got the fax, I filled it out, and I returned it to them. A week later, I called Linda, and I said, well, did you get your approval letter? She said no. So I called the insurance company again, and they said they never received my fax. Okay, well, then I'll just fax it again to you. Finally, this went back and forth a few times, and Linda did get her approval letter, but the approval letter expired the day she received it. Linda did finally go on to get the care that she needs, but I just wanted to point out that this is not some thing that just happened once with me. Physicians, according to a study in Health Affairs, published in Health Affairs in May by Dr. Castellino, physicians spend about 120 hours a year talking to health plans. And the nurses that work with each physician in their practice spend about 920 hours a year talking to the insurance company. And the clerical staff spend about 44 weeks a year. Is this an efficient care? It costs us about $31 billion just as physicians talking to the health plan. The second point that I wanted to make is that there was no accountability. Who was I going to complain to about this faulty fax machine? And in general, this was rationing care by being passive-aggressive. I mean, they were not going to deny a chest CT that was obviously indicated, but they were going to make it very hard for me to get that chest CT, hoping that eventually I just go away. So the current system is not serving physicians or patients. About a year and a half ago, I moved part-time to the Veterans Health Administration. I actually have a panel of patients there right now. And then I saw patient James in the VA, And he had some mundane medical problem. He has diabetic with hypertension, and I needed to adjust his medications. And I realized that the medication that I needed to give him was not on the VA formulary. So I pulled up my screen and I pushed a button and I ordered more expensive medication and made a non-formulary request. It was, 4 hours later, a PharmD reviewed my request and sent out the prescription to James. There was no waiting on my part. There was no waiting on James' part. And a few months later, he went to Florida. And he came back to me and he said, doctor, the medication you started me on, the doctor in the VA in Florida took me off it. I said, why? He didn't really know. So again, on my computer, I pushed a button and I pulled up his medical record in Florida. He had a reaction, and I adjusted his medications appropriately. Now, what I described to you is a real system, a sharing of information, and rational controls. Unlike Linda, where I had to spend so much of my time trying to get needed care, in the VA, I spent under a minute making a non-formulary request, and I got the patient the care that he needed. And in addition, in the VA, the incentives are appropriate. If I take good care of James, at the end of the year, I get a bonus if his blood pressure is controlled and his blood sugar is controlled. My incentives are completely tied to the quality of care that I deliver. I think that the public option would get us the one step closer to having a real system of health care. And I just don't see how private plan option only would actually help us get there. There's no accountability, no transparency, and their primary motive and their service is to the shareholder. I think that the public plan could be a laboratory for experimentation, and we could change physician incentives, and in addition, we could implement an electronic health record and provide guaranteed access. So I think this would be the first step to getting to a real system of care. So you have to ask yourself, why does our current system look the way that it does? And, really the reason it looks the way that it does is that every time we try to have healthcare reform, it was attacked. And our system or non-system developed through a kind of default. So I thought it would be fun to look back through history and see how healthcare reform has been attacked in the past, because I'm sure it's going to be attacked again. And certainly it is being attacked again. So who you see right now, that's Otto von Bismarck. He's the imperial chancellor for the German Empire. In 1915, the American Association of Labor Legislation tried to introduce a bill that would basically provide coverage to the low income. And it was attacked by the special interests of the time. Basically, compulsory health insurance in their pamphlets they wrote was a plot to take over the world. Not to be undone, during Truman's attempt, the usual Lenin health insurance connection was touted, and basically Truman was accused of touting the Moscow Party line. So basically, would socialized medicine lead to socialization of other aspects of American life? Lenin thought so. Socialized medicine is the key to the arch of the socialist state. I know it doesn't really matter, but according to the Library of Congress, Lenin never said either of those things. So the scare tactics have evolved. In 1993 and 1994, we had famous Harry and Louise ads. And basically, again, this time they attacked the idea that Americans wouldn't have choice, and the rationing of care and their health plan not covering what they like. Well, Tom Towles, a Washington cartoonist, 14 years later wanted to check in with Harry and Louise and see if they would again attack healthcare reform. And this is what he found, that Louise had died because she couldn't get her medication, and Harry needed a kidney transplant. The healthcare system was certainly not serving them.